If you've seen a lot of our videos on back pain, neck pain, etc., you know, we really want to try and help you guys at home, and if need be, you can come into the clinic and we can help you here too. But one of the questions that we've had more recently is, what about those severe cases of back pain where you need to get straight into A&E? How can you help people identify the more sinister causes of back pain and basically hopefully help them avoid some rather serious and unpleasant consequences? One of the conditions that people suffer with is Cauda Equina. Now, I must stress that these sorts of red flag conditions, serious conditions that are medical emergencies, are very, very rare, but knowing about the conditions can be really, really helpful for you if you know someone or yourself is suffering with these sorts of problems. Now, we'll cover Cauda Equina today because it's the most common one. What the Cauda Equina are, or is a collection of nerves that come out and really they form the spinal cord in its extension down into the lumbar spine. It starts from approximately here in the lower back, and you actually don't have a spinal cord here. Instead, it is the Cauda Equina, and they descend through the spinal canal and then go out at various points to go down the legs, etc. Cauda Equina syndrome is when you have an injury to the lower back and it presses directly on the spinal cord here, or the Cauda Equina as it would be in the lower back, and that can cause a range of symptoms. Now, some of those symptoms can include sharp, painful lower back pain, but also symptoms that extend down into the legs, bilateral radiations you would call them. They go down either part way or all the way down into the feet, and that's also a good sign that there's something a bit more sinister going on, affecting you centrally on the spinal cord rather than peripherally on one of these nerves, like with sciatica. Very different. The other thing you can experience is saddle anesthesia. So the area of your body that would be in contact with a saddle if you're riding a horse becomes numb. You can't feel it properly, this undercarriage area here. The final thing to watch out for is bowel and bladder incontinence, the inability to control when you're going to the bathroom. If you have a couple of these or one of these accompanied by back pain or with a trauma that set this off, please, please, please waste no time and go to A&E. You'll know if it fits these symptoms because it's very, very obvious when you do have it, and be very specific with what you're saying to the people that you see or on behalf of a friend or family member that you're with when you get to the hospital as to exactly what you are experiencing, because it is classified as a medical emergency. Although I do say go straight to A&E, if you are unsure about it and you don't feel confident with going to A&E, you feel like you're going to be dismissed or have been dismissed in the past, please feel free to reach out to us. We'll do what we can to help you remotely, at least clarify exactly what's going on or what we think is going on, if it is in fact Cauda Equina, and maybe we can help you get the care you need if you're not in London.